for Senior Roundtable. We're so glad that you're here. And we want to especially thank here. I am Laura Steigelman, and I am the facilitator for Senior Roundtable, and I have been for the 16 years that it has existed. And the reason that it has existed is because the Community Foundation that you see there on the bottom there started this all of those years ago. They started doing more work in the senior sector, and they realized as they were talking to the different agencies, different organizations, different people in that world, that they didn't know of each other as much as you would think that would, because they deal with some of the same clients. So it was interesting. They said we need some way for people to be able to network with each other and learn about what other groups do. So this is how Senior Roundtable came to be. And still today, all this time later, they are still our major supporter. And Janet Ellen is our liaison with the Community Foundation. She is on a fantastic, wonderful fantasy vacation with her family right now. She will see this recording when she comes back. But if you have not connected with Janet or haven't connected with the Community Foundation, I encourage you to do so. And ElderSource is everything behind the scenes. They are also a huge sponsor for Senior Roundtable. Gabby, if you're here, give us a wave. And I know Andrea had something first off. She's going to be joining us in a little bit, so she may not be on yet. ElderSource does those emails that you get, the nice, beautiful looking emails. Mine would just be a text sending out to people to say, hey, come to the meeting. So Gabby does all that behind the scenes and does the email distribution list. So if you're not on the list and you want to be, Gabby is one to talk to about that, etc. So thank ElderSource for everything that they do. Obviously a huge player. We've had our meetings there for many years, and we really appreciate all that they do. Okay. So if it's possible to keep your video on, we love to see you. There's sometimes either technology wise or you're just having one of those days that you do not want to be on camera. That's completely fine. It is not a mandatory thing. If you're not used to Zoom, there is a Zoom ruler along the bottom. And along the bottom, you can pop that out if you want to move it someplace else on your screen. But you have a mute button there, and you also have a mute button over your own video square that you can mute yourself or unmute yourself. If you're not speaking, if you're willing to keep yourself on mute, just in case there's some ambient noise behind you or the dog's barking at Amazon deliveries, whatever that might be, then that is appreciated. And if you are able to put your name under your video, we'll put those directions in the chat box here in just a second. By the way, the chat box is also on the Zoom ruler. You can click on that chat box and it will pop up and you'll see different notes and things like that in there as the meeting continues today. But if you want to change your name to include both your first name, last name, and add your organization, if you hover over your own square, you can see where the three dots pop up and you can choose the rename and you can add your organization there or add your last name, whatever you would like to do if that's something that you're interested in people knowing. And this is recorded. We will send this out, a link out next week. We'll process it. If we have any handouts from the speakers or from our sponsor, we'll send those out as well. So if you want to see this or send it to somebody later who wasn't able to join us today, you'll have that option. So a show of hands, who is the first time here at Senior Roundtable? Anybody brand new? I know, Stephanie, I think this might be your first meeting. I'm so happy that you're here. So we have a couple folks brand new. Some of you have been here before. We're really happy that you came back and are going to be able to gain from our presenters today on this great topic. So who is Senior Roundtable? I mentioned a few years ago is when we got started. And it's really for anybody who's interested in what's happening in the senior sector. Services for them, different things going on for the senior citizens, et cetera. It is open to anybody. So anytime that you are coming to a meeting and you say, hey, this would also be good for this other person, feel free to send them the invite. And our goal always is, as it started, to give you an opportunity to network with one another, find out who else is out there, who are some good connections to you, maybe even some connections that you haven't seen for a while. You know, just not as many in-person meetings as used to be just in general everywhere. And then we always pick a topic that we think would be helpful for folks to know about, either more information or who are those resources for that, et cetera. And you can see the mission statement down there. It's supporting seniors through those collaborative relationships. And that's what Senior Roundtable is all about. So our agenda for today is we'll start off pretty quickly here with some organizational announcements. You'll hear more about that in just a second. And then we'll hear from our meeting sponsor. Our meeting sponsor has 3 minutes on the clock to always, the meeting sponsor always gets 3 minutes and as a as a thank you, they also provide us with two $25 gift cards that we put out into a winner at the very end. You do have to be present to win. So if you're here towards the end of the meeting, we'll go ahead and choose for those 2 gift cards, courtesy of our sponsor. We'll then do a couple rounds of meet and greet. You'll get to meet some folks in some breakout rooms to say hello, introduce yourself, find out what they do. And then as you can see, we have a great panel today about the topic of Medicaid, and I mentioned about the door prizes. And then we will wrap up and get you out the door. We finish at 10:30. So if you do have any senior sector announcements that you would like to let others know about, and I always say this one because it's my favorite, but the senior prom that the city of Jacksonville puts on. It could be an over 50 fishing contest that maybe your organization is involved with. So anything that you have that would be appropriate for this audience, please feel free to put that in the chat box. And in the chat box, put the details. How do they get a hold of the information? Is there a link? Is there a phone number? What do they need to know in order to be involved with whatever that is that you are posting? So throughout the entire meeting, if you think of something that you think would be relevant to put in there, please feel free to use the chat box to do that. And then I'll encourage everybody to keep an eye on the chat box in case there's something there that you are interested in. You can make a mental note to come back and grab that information sometime during the meeting. Okay, so we do have a LinkedIn group. You can see that there. It's Northeast Florida Senior Roundtable. We'll also in a few minutes put that in the chat box. So you've got that. Oh, look, Pamela already put in there about the senior prom. Pamela, thank you for doing that. So the LinkedIn group is there for these kinds of announcements, the kinds of things that you're going to see going into the chat box. That's exactly what they are for. And you can also talk about different initiatives that are coming up, maybe with your organization or something that you're passionate about in that senior field. So if you will join us, we get a little notification saying that you're asking to join. They don't alert us as well as they used to. I almost have to go in just every once in a while and check. We used to get alerts. They don't do that anymore. You got to just be smart enough to look every once in a while. So I try to keep an eye on it, and we'll let you into the group, and then you can also network with others that are in there. So with that, I am going to stop talking. I'm going to turn it over to Jane, who is going to speak on behalf of our meeting sponsor today. So Jane, you've got it. And Jane, you're on mute. I'm sorry. And I do that all the time, and it almost makes me feel good to see other people do that because
I'm trying to set the 3-minute timer and unmute all at the same time. So apologies. Okay, so I'm going to start that 3-minute. We are respectful of your time, and thank you for allowing me to help sponsor this. We are part of the senior network out there in this area. Oasis Senior Advisors is actually a nationwide system of certified senior advisors. We cover both the Jacksonville region, all of Duval County, and farther north and a little bit west, as well as what's considered the St. Augustine Daytona region, which goes St. Johns County and St. Augustine, Flagler County, Palm Coast, and all the way into Volusia County. So we're into everywhere from Ormond Beach to Daytona to Port Orange and New Smyrna Beach, DeLand, Deltona, Del Barry. So what we're doing, basically, we're free service. So there isn't a cost for our seniors and families. We're helping them to navigate the very often confusing world of senior living, as well as connecting them to our trusted care partners, because sometimes it's not that they are ready for a senior living environment, but they are ready to get information. So we go through a process. We keep it very personal. We're on the ground. We're with them. We want to be part of their family. So we are taking a very caring and professional approach, listening to what's going on in the family, trying to help them recognize what their needs are, staying connected to our senior resources so that we can provide those services or connect them with those services as well. I reach out to a lot of our partners out there because we do need to help the families get connected with these services. So we will help them with everything from independent living, assisted living, memory care, Skilled nursing and rehabs is sometimes where we direct folks, but not necessarily our specialty. And you know, we're their advocates. We are helping them, especially these days now with dementia and Alzheimer's, helping the caregivers figure out what's needed, working with hospitals, working with palliative care and hospice care. We really want to help seniors have a way that it's not stressful, that it's not overwhelming for the family, and help get them to the resources that they need. We're going to sit down, we're going to figure out, you know, what those care needs are, what geographic area they want to be in, what's the budget. That's a huge part of the whole process, and helping them to connect to the needed financial resources, whether it be veterans benefits or other services. A lot of times we have to help assist them with Medicaid connections, et cetera. And that's my 3 minutes. So I had other things, but I hope that gives a good overview of what Oasis Seniors Advisor, what we are, and the services we can provide. We have 5 advisors, I believe, in the Jacksonville region, and 2 in our Daytona St. Augustine region. And we're here and committed to our seniors. Thank you.
Jane, excellent job. Thank you so much. And again, thank you for being the sponsor. And if you want to put your contact information in the chat box so people can get a hold of you if you would like them to. And again, if you have something you want us to send out next week in the post meeting with the link to the recording, we're happy to include that for folks also. So thank you for everything that you do. We very much appreciate it. So time to say hello to one another. So if you will take a look in the chat box, and again, if you are not familiar with Zoom, which many people aren't, along your Zoom ruler was what we call that black line across the bottom, you have something called the chat box. And if you click in the chat box, you will see some instructions that are going to match right here what is on the screen. Let me go ahead and get all of that up here. Hang on just a minute. Okay. So when you're in the breakout room, there will be a timer in the breakout room. It is really small. That's just a Zoom thing. I wish we could adjust it, but it's not possible. But there will be a timer going off. You'll have a total of 8 minutes. At 7 minutes, you'll get a 60-second countdown that'll tell you, get ready to come to a stopping point, and then it will automatically bring you back to the big room. So we'll send you automatically, we'll bring you back automatically, and share your information. You know, what is it that you do? If you're with an organization, or if you're not with an organization, you're here for some other reason. You maybe just want to hear about this topic, or you know one of the speakers and you want to gain more information about what they're going to be talking about. Room leader, whoever ate fruit most recently, we're going to ask for you to keep an eye on the time and make sure everybody gets a chance to share. And we also would like you to share something fun that you did this summer. So talk about yourself. What do you do? Who are you, etc. Something fun you did this summer. And then whoever that person is that ate fruit most frequently, most recently, if you will please make sure everybody gets a chance to share before the time is up. So with that, if you go into the breakout room and you forget everything I just said, which happens, my son tells me that all the time. He did not hear me say that, and I said it 5 times. So if you are in the breakout room and you cannot remember any of this, if you click on the chat box after you get in the breakout room, you will see those instructions pop back up in the chat box. So let me pause for just a second to make sure there's no questions. All right, so we are going to open up all the rooms and we'll see you back here in 8 minutes. Enjoy your time. So we are going to head into our program. Let me get there. And for our program, while it's happening, I'm going to kind of remind you of who our speakers are and what the topic is as far as the details today. But anytime while those folks are talking, please feel free, if you'd like to introduce yourself. You got to meet a few people in the breakout rooms, but there's still probably 15 to 20 people that you didn't get a chance to meet. So if that's the case and you want to put your contact information, where you work, what you do in that chat box, please feel free to do that. And that'll be kind of running in the background while our speakers are speaking. So I'm going to turn it over to our speakers. We're very happy to have these folks. Everybody is giving of their time, willing to participate, to share their knowledge. Nicole is going to kick us off. Caroline's going to follow, and Kadawndra is going to follow after Caroline. And then if there's time afterwards, we will open it up for Q's and A's. We want to make sure that we get through all of our speakers first, so we have that for everybody, and then we'll go to questions. If you have a question, please feel free to put it in the chat box. I will keep an eye on that. And when the Q's and A's come, I'll go back to those questions or hold it until we say, all right, we've got a few minutes. Let's go ahead and open it up for questions. But if you'll hold on to those until the end, it'll be appreciated. If I see something pop into the chat box and I can quickly sneak it in to Nicole's time because she's almost done, but she still has a couple minutes, then I certainly will do that. So I am going to stop sharing my screen. I know Nicole has some slides. So Nicole, it is all yours. And for all the speakers, if you'd be willing to set your timer so you know how much time you've got left, so you can kind of manage that on your own and let me know if you have, or if you need any help from me. So with that.
All right. Hey, everybody. Welcome. I'm Nicole Egan. I'm the Care Services Director with Aging True. I oversee our state general revenue and Older Americans Act grants in Duval and Clay County that help seniors remain in the community for as long as possible. So today we're talking about Medicaid, but I'm going to go over what is Medicare, what is Medicaid, and why do seniors need Medicaid. So Medicare and Medicaid are both government provided health insurance programs, but they have some different eligibility requirements and benefits. So what's Medicare? If you didn't know, Medicare is the largest health insurance program in our country. It is specifically designed for people 65 and older, but people might be able to get Medicare before that time if they have a disability, an established disability, end-stage renal disease, or potentially ALS. Some people get Medicare automatically. Others are going to have to actively sign up. If you want to look for more info, I've included a link here at the bottom, medicare.gov/basics. So what is Medicaid? Medicaid is a joint federal and state program that really is for low-income persons. So low income and low assets, and it'll cover health coverage for things that Medicare may or may not pay for. So the difference is that Medicare is mandated based on age and Medicaid is not. The Medicaid program is more based on income and financial resources. So why would seniors need Medicaid? Seniors who already qualified for Medicare. The reason here that I'm trying to point out in the picture is that as we age, our income is maintaining and staying stable. It's not going up, but our healthcare expenses are. So that means we have a reduction in our available resources to help pay for healthcare costs and needs. So as we age, our resources, financial, social, altogether may decrease. So when you have insurance both with Medicare and Medicaid, it can offer a more comprehensive set of coverage for seniors to maintain their health. And that's it for me.
Nicole, would you be willing, in case, first of all, Nicole, thank you, because there is always a lot of confusion for folks who aren't intimately involved with somebody who's been on Medicaid or they've been on Medicaid to understand what the difference is. So that's a great start to this as far as what is the difference between those two things. Would you give a plug about Aging True? Why should people know about Aging True and why should they reach out to Aging True? Would you mind spending a minute on that?
Yeah, Aging True, we've been in the Northeast Florida community for over 60 years. We provide long-term maintenance services. We under the Department of Elder Affairs and ElderSource, we actually implement grant-funded programs through the state general revenue programs and Older Americans Act grants that provide those long-term maintenance services that would not be covered by Medicare normally. Personal care, Meals on Wheels, respite for caregivers, adult daycare, in-facility respite, emergency alert buttons, needed medical supplies that wouldn't normally be covered by even Medicare either. So our programs are designed for individuals 60 and older. We have a very large mental health and wellness program. We operate the Meals on Wheels program ourselves. We are the food service provider for Duval County and Clay County senior centers. And we operate 4 senior centers in Clay County as well.
Excellent. And Nicole, if somebody wanted to find out more or check into some of those services, do they call directly to Aging True? Do they have to go through another organization first, or is it a direct call?
Yeah, they can call Aging True at 807-1203 or go to our website, agingtrue.org. Also, ElderSource oversees our waiting list. So if you're on the phone with ElderSource and you live in one of our areas, you're most likely going to be directed to us as well.
Excellent. Nicole, thank you so much. I very much appreciate it. And if you're willing to put your contact information in there, Aging True's contact information in the chat box, that would be awesome. So thank you again. And we're going to move on to Caroline. And Caroline, if you'll do a self-introduction, just so I won't have to go back to the slide, but if you'll do a self-introduction, and then we're very much looking forward to your information as well. So Caroline, you've got it.
Hi, my name is Caroline. I assist with Florida Medicaid Specialists. I assist with Medicaid for long-term care. I have something so you guys can share a screen. Is that what I do? Yeah, okay, making sure.
Yes.
Share screen, and I think that's, can you guys see it? Making sure.
Yes.
Okay, so with the, so let me start the timer. Got it. Okay, so what I assist with the long-term care Medicaid side. I actually refer a lot to ElderSource and to Aging True. I've done that for a really long time because I really love that organization, period. In regards to the Medicaid, what I'm here to be able to help you is the eligibility. A lot of people get confused in regards to what are the standards, what is the need, what do I need to have? Just because they get a lot of misunderstandings. So the eligibility, I put that here so it can be understood. With the long-term care, as exactly what she stated, Medicare doesn't cover for them to stay in a institution. Let's say they can no longer stay at home. And then there's the waiver, which ElderSource can explain that because I know that they're presenting. So they also provide with the long-term care side to be able to remain at home as long as possible. So that's part of the Medicaid waiver as well. There's different eligibilities. So in order to be eligible for the long-term care Medicaid, you need to be able to have the income and the assets. First, the income you cannot exceed no more than $2,829 individually. Now, this I'm just speaking on an individual person. If it becomes just remember, if it's a couple, just add it by 2. So it'll be $5,658. You cannot exceed that as an income. Regards to a couple, but for an individual, it would be $2,829. If you do exceed that, then I will go ahead and explain in regards to the qualifications and what I can do for you. But that is all sorts of income. That, as I put it there, in it's Social Security, pension, VA, alimony, annuity, dividends, rental property, so forth. And a lot of people misunderstand because VA, they state that it's not supposed to be considered, like the VA aid and attendance. They say, no, they told me that the VA aid and attendance is not considered income and we're fine. They don't say it. They apply for Medicaid. It gets rejected. Unfortunately, that's a long battle between Department of Children and Families and the VA. That is considered income, because it comes to you. So anything that you are receiving continuously and repetitively, that is considered income. So the VA aid and attendance will be income. Anything from that you're getting some type of money coming in consecutively and continuously, that will be considered income to DCF. It's just depending on the category. So asset-wise, you cannot have or exceed no more than $2,000. So assets, as you can see here, as a place, assets can be bank statements, CDs, IRAs, stocks, bonds, real estate, one home is exempt, but if you sell it, then now it's become an asset. Of course, there's ways to protect it, and I can explain that in regards to how I can help. But with the reverse mortgage, that's considered income now. So there's a lot of different things. Again, as you can see, it starts getting very complicated, which is why a lot of the times, a lot of my seniors, it becomes, a lot of our seniors, it becomes a little stressful for them because it's just, and if you Google, there's a bunch of stuff in there that is being advised that some of it is true, but it's in general. So that's why I put a little bulletin. Every scenario and every case is different. So not one is alike. I know that everybody's applying for the long-term care, but not every case is the same. Now, also funeral burial arrangements, life insurance. So what I like to explain how DCF is, or Department of Children and Family, or Medicaid long-term, to explain, to make it easier for people to understand, look at DCF or Medicaid long-term care as a bank. And you are requesting as a loan. So you're coming into Department of Children and Families and requesting to be able to obtain a loan from them. You are stating that you are in need. You don't have this. These are their requirements, just like if we're going to ask for a loan for a bank, for anything, for a car, anything, we have to show them our income and we have to show them our assets. And what we're saying is we're never paying back this loan. So that's how I like to explain it to families, because they're like, oh, but I have this, but I don't even know I needed to show you this. Because yes, you do, because you're showing Department of Children and Families that you don't have the resources anywhere else, and they're your last option. So that's why everything is considered. Anything that you can cash value, anything that house is a sell because that's an asset, a car could be, a life insurance because you can't cash it out, so you can get money. Okay, so these are the things that I'm able to help the families understand, because a lot of families don't know. So those are the required eligibilities in regards to that. Now, for the qualifications, it's in regards, I also point and pinning it out as well, in regards to, as what I was stating, the 2000 and the income and asset. Now, if you are over those, that's where I'm able to go ahead and be able to help you with that. So for instance, I get a lot of seniors that just met about the 2,829. They're at 2,900 because it's not net, it's gross. These Department of Children and Families, the state goes with the gross amount. So a lot of families are like, oh, but they don't get that. It doesn't matter. It's a gross amount, because when I apply for Medicaid, I also apply for the Medicare savings plan, which helps you be able to obtain Medicaid, pay for the Medicare savings portion, which is the A and B portion that you are being deducted anyway. So now you're going to now honestly get your gross. So that's why they look at the full gross income as well. So just because they're over a few doesn't mean you can't get qualified. That's where I'm able to help them. I can direct them to elder attorneys that I have great, relationships with. I like to work with elder attorneys that don't like to charge ridiculous amounts that I have heard, and I get them from families. I get them from my personal experience working with a lot of them, meeting with them, I've met a lot of elder attorneys that are really, really good in their pricing. They're really, really reasonable. That's how I've met them, and I've actually referred them because of families using them, and it's been good. So with the income limit, it will be called a qualified income trust account. So what that is anything that you're over the $2,829, you're going to have to create a new account, which is overseen and requested by the state of Florida by a qualifying income. So it's exactly how it sounds. You're qualifying them income-wise, and you're creating an irrevocable trust account. So with that said, if they're over a penny or they're over $100, that overage is what you're depositing every month like clockwork into that account. And only two banks open those accounts, which is Wells Fargo and Bank of America. Those are the only two. Back then, back until 2018, a lot of banks were doing it, but now the only banks that are able to open those specific accounts is Bank of America and Wells Fargo. So with that, I help the families. I go to the banks. I help them open up that account, how to open it so they can open it up properly. They have to fund it properly in the month that they're requesting the long-term care insurance. And then every month I'm making sure, and I text families and I follow up with families, the ones that, don't, that I've seen that are gonna not be able to grasp it well. And I let them know that, hey, did you deposit the money? Remember, you have to deposit X amount of money every single month in that account, so they can be eligible. So the difference of this account is it's only used for medical purposes. It cannot be used for anything else. Medical meaning prescription drugs, depends, co-pays, room and board into a nursing home, into an assisted living with the waiver, things like that. That's what's called medical reasons. And at the time of passing, whatever money that's in there, the state will get that money. You will turn it over to the state. Whatever money is in there, that's the money belongs to first ones that have the hand in the cookie jar will be DCF from not DCF but the state from to be able to get that whatever's left over from the funding. And then of course then there's the over assets. There's a lot of different ways if you're over assets, because it could be the $2,000. So a lot of the times they're just a little over, or they're maybe a little over. And let's say they're about 50,000. I'll just say that they have $50,000. That was their everything. That was all their savings, and they're needing to go into an assisted living. They just but they can't afford it long term. But they don't want to go to a nursing. But she doesn't qualify, or two, the family just doesn't want to. So they want to go for the Medicaid waiver. So with that, you assist, I put there the most standard one, which be a personal service contract agreement, or a personal service, or just a service agreement. And what that is, it just legally moves the money over from one person to another. And they have to have a durable power of attorney in order to do that, with the correct verbiage in that personal service contract, in that durable power of attorney, to be able to grant you the rights to be able to create a personal service contract as well as a qualifying income trust account. So there's certain verbiage that is needed in order for you to be able to have the rights to create these documents. There's a lot of other different types. There's pool trusts. There's so many different ways of asset wise. And again, depending on the scenario and the age, but there's a table that the state requested for us to follow. So what a personal service contract is, it's basically assigning a caregiver as their exactly what you hear, providing them service. So there's a life expectancy table, and then there's a number behind that life expectancy. So you, like us with kids, with our parents, we're just naturally taking them to the doctor's appointments. We're covering their expenses. We're trying to arrange them. We're doing this. The families are taking care of trying to get Medicaid approved for them. So that's a service, paying their bills into the long-term care facility or community, things like that. That's a service. So that would be all split up and all specified in this contract. And then they will put them an hourly rate and how much they're going to get paid for their duration of their life expectancy. And there's a time frame. So if they're 98, their life expectancy is probably 2.5 years. In those 2.5 years, I'm just throwing numbers for argument's sake, 2.5 years, it's going to be $40 an hour for the next 80 hours for the next 2.5 years, totals $120,000. So for the next 2.5 years of that person's life expectancy, you're allowed to transfer up to $120,000 to your name from theirs to you. So like that, they're able to meet criteria to obtain the the long-term care insurance side of the Medicaid. So there's other ways and usually I do, if there is a limit, there is a cutoff limit, and I do tell them, okay, you need to pay for funeral expenses, you need to pay for this, to help out, because if they don't have a paid funeral expense or anything, then of course, definitely use that before you transfer the money, just pay it off, but make it, remember what I said, it needs to be irrevocable. Without that, you can't get it approved. So you could have a burial arrangements and pay for burial and do everything, but you need to make that irrevocable. If you don't, then Medicaid will be disqualified, and you're not going to qualify. So there's certain rules. Now, going back to the couples, now that I explained about the couples are different. They work a little bit differently, because they don't need a personal service contract most of the time, because as long as they don't exceed the 180,000, I like to cut it down to 140 to 180,000. As long as they don't exceed that limit, they can transfer funds out of their spouse and into their name. But if the couple is both applying for Medicaid, then yes, you would need to get a personal service contract. But if just one, like the husband is applying and the wife doesn't need it, because the husband's going to a nursing home or is going into an assisted living for memory care, then you will definitely try, and they only have, let's say, $25,000, then the wife can do an interspousal transfer. There's other ways and a lot of different, things that come along with that. And that's where I come in to be able to help navigate everything to, one, understand the process, and two, understand how to do it and not get lost and not do it incorrectly with the legal backup that I have with elder attorneys. Now, the length of getting approved, it's between, once the application is submitted, it is between 30 to 120 days for you to be able to get approved for Medicaid. It is a very long wait, and that's where patience that very much gets tested to families. But I could, there's URLs that you can contact, that you can message DCF, you can call them. I mean, you're going to be there for a while, but the length of you being able to get approved for Medicaid once the application is submitted is between 30 to 120 days. And DCF can approve it. They don't have to respond to you. They don't have to send you a notice of case action, which is called a NOCA for short. They don't have to. They have up to 120 days to let you know if it's approved or if it's not approved. So that's the length in regards to that. Now with the that's for the long-term care for community or nursing home, but for the waiver, ElderSource would explain, but there is a wait list and there is steps in order for you to be able to get there. There's 4 steps, and I'm pretty sure definitely ElderSource, I would leave that to them, but that's what I'm able to be able to let them know. It's not an easy process. Definitely don't start it when you're about, I always, with OASIS and everyone, I always try to help them out and let them know, like, it's better to help them now than later, because you don't want to get to a point where, oh yeah, I have 20,000, I'm going to put her in an assisted living and I'll just apply for Medicaid later and I'll get it, because it's 120 days. It doesn't work like that. You need to first be eligible. You need to first meet the requirements, and you don't want to get to the point where you don't have the money at all, because nursing homes don't accept Medicaid pending most of the time now because of the change as of December 5th. There's a lot of backlash. There's a lot of kickbacks. There's a lot of things that are being kicked back to us, to the nursing homes that they're scared, they're losing money. So you want to be able to make sure that you have everything in order before we apply, because that's when it's needed, and that's when it gets really complicated and stressful for families. So I try to help them before the high need is requested, to be able to prepare them for that process. And that will be my presentation.
Caroline, thank you. I didn't have my timer going specifically for yours. Do you have a few minutes left of yours?
I do,
time?
11 minutes.
All right, so let me just open it up and I can see the participant list. If you have a question for Caroline, unmute yourself and I will call you by name just so you're not feeling like you're going to talk on top of someone else. So if you have a question for Caroline that you think would be helpful for everybody to hear, please feel free to unmute yourself. Let me just make sure. Shirley, please. Shirley, you're unmuted. I don't know if you mean to be, but you're unmuted. Did you have a question? Okay, might have been an accident. Okay. And then somebody's asking in the chat box for your contact information. Caroline, eventually when you're done, if you'll put that in there, could you email everybody this eligibility form? Is a question that's also being asked in the chat box.
Yeah, sure.
Okay. And Caroline, if you want to, you can even put it into the chat box. And then if you want to send it to us afterwards, we'll send it out next week with that post meeting. So before we let Caroline off the hook, at least for now, if there's time afterwards, we'll get back to her. But does anybody have any questions for her before we head into Kadawndra? Okay. Let's see, Pamela. Pamela's unmuted. Did you have a question, Pamela?
I did. Thanks. Hi, Caroline. Can you review again what it was that you were talking about with the transfer of assets? How would that work? What are the limits on that?
The limits in regards
Yeah, like per year. What was it per year, and what purposes?
well, if they're over the 2,000, let's say they have a couples, let's say a couple, they can do an interspousal transfer. That's something that's you know, again, it has to be that limit is 180,000. So they raised it, so they cannot exceed that amount. So if they have over 180 as a couple, 180,000. If they have exceeded that, then yes, you do need to get with an elder attorney so they can help create a personal service contract.
Okay.
It all varies. So it again, that's where I come in, because there's, again, that's why I put a very huge disclaimer up here. It's different. These are specifications, but I have to see it. And when I see it, it can be like, oh yeah, I have 180. And then I look and I'm like, oh, you actually really don't. You have more than 180. So, and that's where I'm able to, you know, pick and choose and see what is needed and what is not. And I can be able to let them know, you know, let's go ahead and play this safe and let's get an elder attorney, because I don't feel that if we were to do this without one, you're going to get approved. And right now, and I'll be honest, I'm very transparent. These Department of Children and Families are getting very, you know, they're combing everything. And sometimes the things that they come up with that wasn't in their guidelines, they can reject. And then I have to go into a hearing, and it all depends on the hearing officer if they want to even agree to that. Even though I pointed out in their guidelines, they can still come back and disagree, because it's up to the hearing representative to approve and agree with what I'm saying, with all my evidence and their evidence. So it gets, I don't want to get it there. So that's why I look at it beforehand. So yeah, with the asset portion, it cannot, for couples 180, for an individual 2,000. There's ways to go about it, but I always say a personal service contract is always best, to avoid, if it is a lot of money, it's usually the go-to that's a lot easier for families.
And Pam, does that help?
It does. I think it was probably the personal service contract I had missed that portion of. I got a text message that came in that drew my attention, but I can listen to the recording.
Yeah.
Oh no, it's right here on the paper. I put it right here. It's over assets, it will be
Right.
Service
Right.
contract.
I got that. All right. Thanks.
Excellent. All right. And then any other questions for Caroline? Let me check and see if anybody's unmuting. All right. And then Caroline, somebody is asking for your contact information and your website, etc. And then Carolyn Emery, I just saw that you had unmuted. Is that what you wanted to ask for also? Did you want to jump in?
Yeah, yes, thank you. It's Caroline Emery. But
Caroline,
yes,
thank you.
that's fine. Everybody gets it wrong. Yes, I've tried accessing the website and I don't seem to find it. So if she could clarify that, I'd appreciate it.
Sure. My website?
I think your
The-
website.
The FL Medicaid specialists.
Oh, yeah, I don't have an actual update of
Ah,
website. Yeah, no.
okay. Got
I
it.
was told that there's that's actually the actual company name of mine down in Brevard or something, but that's not me. The family had actually messaged me. They're like, "Oh my God, I see your website." I was like, "No, I don't have a website yet." I was like, "Not yet." I'm really more of a word of mouth. A lot of, referrals come from families and people and
Okay.
individuals. Yeah. So
Okay.
yeah,
Is
but
there-
I could, I mean, I haven't seen a need for a website, but I can be more than happy if you guys need.
No, that's fine. I was just trying to find this chart. Is there a way to get a copy of this chart
Oh,
then?
yes. I can forward it over. Laura asked me, so you just let me know how, and I can definitely go ahead. But just remember, that's why that big disclaimer, it can change. So
Yes,
if
yes.
you need
of
help,
course.
I'll put my phone number, I'll update it because I noticed that I only put my email. I'll put my phone number in it. I'll edit that and then I can send it over. And if you guys need help on understanding all of it and how to explain it and so forth, definitely give me a call. So, but this is just like a little bit of a, how do I say, grid to be able to know how to help families if they tell you, and then you can refer me out if you like.
Right, thank you. And is this your email address that's showing up?
Yes.
Okay,
Mhm.
perfect.
And then
Okay.
I put in my chat a little bit while earlier, but I can redo it again. My phone number.
Thank you so much.
You're welcome.
Caroline, this is Margaret. I have one question with the personal services contract. When you set that up, is that one family member who carries out all of those services? Or could it be multiple family members who carry out those services?
So DCF back in 2019 used to be okay with multiple families. So we elder attorneys are threading lightly with that just because they started getting creative. Families started getting creative, if it makes sense, and it started hurting. One bad apple kills a lot of kills the good apples. So they're being very selective with it. So it depends on how much assets it is. Like, we have to arrange it. There is a limit of the assets, but yeah, they can be. So it can be, again, depending on the scenario, but it can be, and it's depending on the assets and how it's traded, and of course, remember what I said, is the durable power of attorney. It all depends on that. So we need to make sure that the people that are being spread out to have the rights, and were mentioned in that durable power of attorney, but it can be, and it can be selective.
So that the person providing the caregiving services has to have durable power of attorney. Is that what you're saying?
Yeah,
Okay.
the person
Any of
that
the caregivers family caregivers would have to have that durable power of attorney.
they would have to be the durable.
Right.
Yeah, they would have to be in it, secondary, third. It's okay, but they have to be mentioned, and they have to have the rights to be able to get the personal service contract assigned to them.
Right.
Yeah. So and the other main thing that I have to advise, and it completely crossed my mind. I'm not a CPA, so we have to say it by law that once the money is transferred, if you do a service contract agreement, that's considered income to the person that the money's being transferred to. So you will have to consider it as income, and you may pay taxes at the end of the year. Again, I'm not a CPA, and we're not, neither is an elder attorney. So I have to by law state those disclaimers. There's again, it all depends on your CPA. I have spoken to a lot of my families who have had a personal service contract, because I do every year just to find out if they've paid taxes, and a lot of them has said no. One, I know I have 2 minutes, but one way that an elder attorney explained it to one of my families that I was like, oh, that makes sense, is unless your father or mother or your loved one, whoever you're getting the Medicaid for, gives you a 1099, then you usually, that's will be income, but technically you should always place it and tell your CPA about the money that's coming. But there's ways about it. Again, that's a CPA thing, but yes, I always have to put that disclaimer out there.
Thank you so much.
Great, good questions, Margaret. Thank you. Okay, So Caroline, thank you so much. Huge round of applause again for both of our speakers so far. We really appreciate it. And we're going to move on to Kadawndra. So Kadawndra, you've got the floor. If you will please share. And there you go. Okay, Kadawndra, all yours.
Okay, I am Kadawndra Sales, the Intake and Screening Supervisor at ElderSource. And today I'll be discussing assessing the long-term care services through the statewide Medicaid managed care long-term care program. The first step would be screening. For community-based clients, they must complete a screening in order to go on the waiting list for the long-term care program. That screening must be completed by a member of our Aging Disabled Resource Center. This screening is done by phone with the person, or the caregiver must be an authorized representative for that client in order to do the screening. The screening takes about 45 minutes to complete. We go over general health status, activities of daily living, what they're able to do for themselves. If they need assistance, how much assistance do they need? How much assistance do they currently have? Health conditions. If there is a caregiver, we do look to see if the caregiver is under any type of stress. Also, we go over therapies and nutrition if they're looking for services such as Meals on Wheels. For clients that are released from the waiting list, the Department of Elder Affairs works with the ADRCs to manage the wait list for the statewide Medicaid program. Each month, DOEA will release individuals from the wait list, and that's based on frailty and their scores. And that's in accordance to enrollments approved by the Agency for Healthcare Administration. So every month, when it's time for a release, DOA will look to see who are our frailest clients. Those clients, once they get that number, they go to the Agency for Healthcare Administration. The Agency for Healthcare Administration then approves those lists. DOA notifies us what clients have been approved to be released from the waiting list to start the Medicaid process. After each screening, the clients are mailed a letter that will tell them what their ranking was, their priority score, and their ranking, and it gives them some more information about, there's a website which I have linked in the final slide that could give you more information about the program and the process. So for those clients that are released from the waiting list for the Medicaid program, they will get an additional letter once they are released from that wait list from our enrollment team, our Medicaid enrollment team, and that letter will let them know what's needed. There's several different letters that go out because we have to check to see if we have a medical form for them on file or whether or not they have any type of Medicaid. So that last step would be for the Medicaid eligibility. Every client is going to need the medical ACA form, which is the 3008 form that has to be filled out and completed. Once that is received from our office, that team will forward that on to the Department of Elder Affairs.
Kadawndra, I think you
visit, they'll do a full comprehensive assessment, and they will determine if their client meets the medical level of care for the Medicaid program. For clients that are not already financially eligible for Medicaid, we will check to see if they have any type of Medicaid, if an application needs to be filed, or what exactly needs to be done. So that team can go in and see if the client has any Medicaid, and they will let them know what is needed, if they need a full Medicaid application, or if there's just certain documents they may need to update and certain forms that we have to send to the Department of Children and Families in order for them to be processed. Clients that are determined financially eligible for the Department of Children and Families, and they also have that medical eligibility from CARES, will then be enrolled into the Medicaid program, and they will get another letter from the Agency for Healthcare Administration telling them that everything has been approved, that they can go through with the program, and they get to choose a plan. There's 4 plans in our area. that they get to choose from. So they will be auto assigned to a plan, but if they do not like that plan, they do have the option to change within a certain time frame. Again, we only assist clients that are released from our waiting list with the Medicaid applications, and we do not assist clients that are currently in nursing homes. We only do those home or ALF clients that get released from the waiting list. This is our number to call for our helpline. So once you call this number and express what you need, our helpline can either give resources or they can schedule them for an assessment. Currently, our helpline schedules 60+ assessments for us daily. We get that many referrals daily. And also with our waitlist releases for the Medicaid program alone, we average around 200 per month clients that are released from the waiting list for the Medicaid program. And as Nicole mentioned earlier, we also do non-Medicaid programs since everyone does not qualify for Medicaid. We do the waitlist management for those programs. And as those providers have funding available, they notify us and we release those clients. We identify those clients and release those to Aging True or to Clay County Services, Senior Services to provide services for those clients. And that website is just a link here to the ACA website that goes step by step over the process in case you have any other questions. It goes through all the eligibility steps for you. And that's all.
So questions, Kadawndra, thank you very much. Questions for Kadawndra, and please feel free to unmute yourself. I'm on my second screen. I've got the list of participants. I can see if you've unmuted, so please feel free to do that if you have any questions for Kadawndra. Let me pause for just a second in case someone's thinking of something they'd like to ask. Margaret, please.
What is the average wait time once you're on the waiting list?
There is no time frame for being on the waiting list. So it's all based on frailty level. And
is there a range? Like, is it a minimum of 6 months, a maximum of?
There is absolutely no time frame that we can give because it all depends on frailty and funding availability. So there could be funding tomorrow for some different programs. Some programs may not have any funding. So it all depends. We actually cannot give any sort of time frame of how long a client will be on the waiting list.
Understood. Thank you.
Pamela, please.
Thanks. Kadawndra, could you go back to that last slide with the web address? Yeah, thanks. If you can put
And
that up.
Kadawndra, I don't know if you're able to grab that and put it into the chat box. Is that something that you can do? And then and this is for all three of the speakers, if you're comfortable with us sharing your slides in the post-meeting email, we're very happy to do that. If you want to send those off to us, we can even convert them to a PDF and just send them as an attachment for folks. So if you're able to pull that off and put it in that chat box, that's great. I don't think I can do it from our side. No. Okay. Okay. Pamela, we have like 3 minutes before we're getting, Kadawndra, thank you. You got that in there. Pamela, you have some other kind of knowledge that maybe would be helpful. Could you cover, I think it's with the assisted, something that you shared with me at a previous time. Do you have 3 minutes that you could share anything in addition to this from your experience and what you do with your clients?
Yeah, just really the understanding that for the Medicaid for nursing homes is really a comprehensive payer. So whatever that person's income would be, that would be paid to the facility as their patient responsibility, less any eligible expenses like paying their Medicare premiums or whatever else. But so whatever is needed up to the full amount of the contracted Medicaid rate in that skilled nursing facility, Medicaid will pay. But the program doesn't pay the same way for assisted living. I find in my work that that's probably the biggest misconception is how Medicaid pays for assisted living. It does go through an insurance company. That plan has a contracted rate per facility. And not all facilities that do accept Medicaid, assisted living communities that accept Medicaid, accept all the insurance providers. So, you know, it's complex because you need to make sure that you're choosing a provider that's going to be accepted by the assisted living community that you want to move to. And you also need to know that it's only going to pay on average, about $1,500. So if your income plus the $1,500 is not enough to meet the expenses, then that person may not be eligible to move to an assisted living. It's kind of a not a one size fits all program for sure. Okay. So helping people understand that it is not that comprehensive payer like nursing home Medicaid is, that there are a limited number of assisted living communities that do accept Medicaid, and the way that they apply the Medicaid benefit can vary from community to community. For some of them, it comes off the total cost. For some of them, you have to be able to afford the rent payment, and there may be a special contracted rent payment only on specific sizes of apartments. And then they may utilize the Medicaid benefit to pay for the care. So be sure to consult each individual community that you're looking for to make sure that the plans that you're making are going to be a viable plan for the place that you want to live.
Excellent. Pamela, thank you so much.
Thank you.
Kadawndra, thank you so much. And for all of our speakers today, we really appreciate it. Medicaid is a huge, gigantic topic. And I know that when my mom got colon cancer many years ago, she's passed away since then, but eventually all her money for all the copays and everything else were gone, and she went on Medicaid. And I remember there's a lot of different things that she was now able to tap into because she did absolutely qualify for Medicaid, and they helped with a lot of different things, including paying for a family member to be the home caregiver for her. She got permission for that to happen. So there's a lot of different things. You've got some great resources here between Aging True, ElderSource, Jane's group, Pamela's knowledge, and of course, Caroline as the Florida Medicaid specialist. So thank you all very much for that. So anything that you want to send me for speakers, etc., I will include that next week when we send out that email for everyone. So please feel free to email me anything that you'd like included. So we would like to thank, and if you're here, and I see some of you here, if you'll wave your hand, these are the folks behind the scenes that get these meetings to go forward. They think of what the great topic is that they should have, who are some resources that could help us with that, who are good organizations to invite in to talk about what they do, et cetera, on that topic. So huge thank you to all of these folks here. They make it happen. They make the calls, they reach out. If you have ever been a presenter or a speaker, you know that somebody here probably contacted you to say, hey, would you be willing to help us out? We'd love to have you present for us. So speaking of our next meetings, we are really excited to tell you that we have an in-person meeting coming up. We cannot thank River Garden enough and the Community Foundation. They have brought to us, Community Foundation has a relationship with Susanna P. Barton. She's a local author here in the Jacksonville area, and she has a book that has recently come out. She's going to come and speak about her book. You're going to see more details about this over the next few weeks, but plan on Senior Roundtable being in person on September 13th. It's really a very fascinating book about planning for what's next in your life as you continue to age, looking towards that future, et cetera, and getting kind of things in order to do that. And I don't want to take her thunder away, and I'm certainly not saying it as well as she's going to. So you'll see information on that. Huge thank you to River Garden. They're providing not only the space for us, but they're also providing breakfast. Of course, ElderSource will be handling everything behind the scenes, getting the email invites sent out and all of those kinds of things. The Community Foundation is purchasing a lot of books, and they will be giving those away to those folks that are attending the meeting. We hope to have enough for everybody. You'll see more on that also. And the author has very, very graciously, and I think she was almost embarrassed when I asked her if she would stay and sign books for anybody who wanted it to be signed after the meeting was over. And she said, absolutely yes. But her look on her face was like, okay, I don't think anybody's ever asked me to sign their books before, and I'm happy to do that. So that's coming up in September. That'll be an in-person meeting, and then we'll finish out in November, probably a Zoom meeting for that November 15th to round out this year. So I'm gonna go ahead and head into the gift cards now. Thanks to Oasis Senior Advisors, Jane Norton. She has donated two $25 gift cards. They'll be emailed to the winners and we're ready to switch over to our wheel of names. Can you make this go away so I can see? All right. Laura, are you here? You have to be here to win. I can't see everybody's screen just because.
I am here.
Laura, congratulations. You have won
Thank
a
you.
$20 gift card. And can you guys see the wheel spinning? Were you able to see the wheel spin? Okay, so let's go to the next one. Laura, I'll get with you after the meeting. And Debbie, are you here? Debbie Crawford, are you here with us?
Yes, I'm here.
Debbie, so you have also won a $25 gift card from Oasis Senior Advisor. So congratulations. Again, I will get with you after the meeting is over. So
right,
with that, we are officially out of here for today. I hope everybody has a great weekend. We hope to see you in person in September. Between a fabulous facility at River Garden with their breakfast is top notch. That's a benefit right there in itself. Getting to hear this author talk about something that's near and dear, not only to the folks that we serve, the seniors, but also for ourselves. So it's got a kind of a double bonus whammy there in a good way. And then of course, everything that ElderSource does and Community Foundation purchasing the books as a giveaway to everybody who comes to the meeting. So thank you all to our speakers and everybody who is participating today, Senior Advisory Committee, and we hope to see you in person in September. Thanks, everybody.
Can't wait to see you. Happy weekend, everybody. Thank you, Laura.
Bye-bye, everyone. Thank you.
Bye.
Be-